today I'm going to go through Dabigatran management using the Dawn system. Now, for those of you that already use the anticoagulation software, this is the screen that you're very much used to. This is the main patient screen. We can see, just on the history tab here, we can see all the various INRs and visits, and we can see on the dosing tab we have a space to enter our next INR. In the Dabigatran module, our patient screen looks a little bit different. This is how it looks within the Dabigatran module. Now, instead of having a history tab, which shows all of the INR visits, we instead work from the questionnaires tab. And instead, up at the top right here, of having a dosing tab with a space to put in the next INR, that's been replaced with the Dabigatran tab. Now, what we're going to do is we're going to go through the workflow of how you would use this. So, like I said, Dabigatran patients are actually going to be managed by the questionnaires functionality. We have two separate types of questionnaires within the Dawn system. We have, first of all, an initiation questionnaire. So that's going to tell us whether the patient is appropriate to be moved to Dabigatran. And if they are, then it will advise us on the correct dose for them. And then we also have a follow-up questionnaire as well. So if a patient does get moved to Dabigatran, maybe 6 months or a year's time, you might want to give them a follow-up, see how they're doing, see how the compliance is going, if they have any problems, etc. So let's have a look at the workflow. First things first, when we're in the Dawn system, we find our patient. They could be a new patient or they could be an existing patient on warfarin, and we complete an initiation questionnaire for them. So we go through that questionnaire and we can then make our decision from there as to whether they're appropriate for Dabigatran or not. If they are, we then go and stop any existing treatment plan for the patient if they have one, and we then activate a new treatment plan with our correct dose of Dabigatran. And then last step here is we schedule a follow-up date for the patient. So are we going to see them again in, like, say, 6 months or a year's time? If we are, we can schedule that into Dawn. And let's start a patient on Dabigatran. Okay, so I'm just going to log in now. Right, I have a patient in mind. I'm just going to look them up. So I'm looking for Jason Stafford. There he is. Okay, so I can see Jason's already on the system. He's on warfarin at the moment. I'm going to look and see if he's suitable to be put onto Dabigatran. So first things first, I need to fill in my initiation questionnaire. I have my questionnaires tab all ready for me at the bottom right here. I'm going to click on that, and I'm going to click on this little blue form icon with a yellow star to add a new questionnaire. I'm going to choose the initiation questionnaire. I'm just going to double click on that, what it means. Let's scroll down. We have our name, we have our due date, we have our therapeutic indication. So let's choose one of these. We then have our qualifying risk factors, again just check boxes here. And we then have duration of use. So we're going to do long-term, post-op, short-term. Okay. Scrolling down the page, we have our two options. We have our measured creatinine clearance, or we've got our Cockcroft gold estimate. So let's pop in an estimate. Let's pop in there serum creatinine and the body weight. If I click on calculate, I've then got my estimate here. I can see that that's logged as mild renal impairment, so no cause for worry yet. Quite happy with that. I have my hepatic impairment checkbox, check that or not, and I have my other blood checks box, again just free text field to fill in. Scrolling down, I have contraindicated drugs. If I do click on one of these, it will pop up in red with a big red cross. This patient isn't going to be appropriate for Dabigatran. Just to bear in mind as well, I didn't mention earlier that, again, these lists here can actually be amended. So if there are any other contraindicated drugs that do pop up for this, for Dabigatran, then we can add them to this list as well. So I'm going to uncheck that, I think, for this patient. And we'll move down to interacting drugs. Like I mentioned earlier, if you do click on one of these, you will get some guidance over on the right in red, so you can read through that and see what you think. If we have more than one checked, we just have guidance for both there as well. So I'm just going to uncheck these. Moving down, other anticoagulants or platelet inhibitors, again, just check boxes here, and anything else, pop it in this box. We then have our checkbox for, okay, if the patient's on warfarin, is the INR greater than or equal to 2? If I check that, I do get my little warning saying, okay, don't start Dabigatran until the INR is less than 2. Let's go and check that. I then have other contraindications, anything else going on here, any other issues. If I click on one of these, that will appear in red with a cross. Again, if one of these is checked, or one or more, this patient isn't appropriate for Dabigatran. And let's move down as well. Okay, so again, hemorrhagic risks, one or more of these. Does the patient have any? Simple checkboxes. And then we come to our CHADS-VASC and our HAS-BLED. So we can work out our CHADS-VASC quite easily. And then we can work out our HAS-BLED score using these criteria as well. Okay. Moving further down, we have our procedures planned, just a free text notes field, pop any information in there. Who's going to follow the use of Dabigatran? Again, it's just a scroll down, it's just a drop-down list. So let's choose the anticoagulation clinic in this instance. We have our age at due date, which I can see just there. And scrolling down, I can see the Dabigatran dose section. So Dawn is suggesting, okay, Dabigatran 150 mg twice daily if it's the normal dose, or 110 mg twice daily if the patient's 80 or over or a risk of bleeding. So when I click on the drop-down menu, I have all the different types. Now, if I click on 220, if I get this wrong, click on 220, I get the big pink box. It's saying, no, this dose is not appropriate for this therapeutic indication. So I can go back and say, okay, fair enough, I'm going to pick this one. And then Dawn's happy with that. Any other final additional comments, we can pop them into this box here. But again, the most important thing is once we're done, we can click on the Mark as Complete button. And as soon as you do that, we have a status of complete, we have a date and time stamp, and we have this unlock button. So from this point, we could just say OK at the bottom of the screen. And you can see now that my questionnaires tab is now filled in. So I can see the initiation is complete, and this is the summary information under here. So the patient is deemed as being appropriate for Dabigatran, which is great. What I need to do now is go into the patient's existing treatment plan, stop that, and start a new one for Dabigatran. So to do that, up at the top left, I'm going to click on the treatment plan button just here. And what I'm going to do is I'm going to stop this current warfarin treatment plan by clicking on the stop button. Dawn will ask me how you sure you want to do this. I'm just going to say OK. Okay, and I'm going to click on the new button at the bottom of the screen to add a new treatment plan for them. So I need to choose a diagnosis, and I need to choose a valid one for Dabigatran. Okay. I then need to choose duration type. I can then choose the kind of common things like preferred clinic, that kind of thing. More importantly though, over on the right here, where it says target range, obviously this isn't appropriate anymore, so we just choose the non-VK option. And then under regime, we can choose the correct amount of Dabigatran. So let's choose the 150 mg. Once I'm done with this, if I just click on activate and say OK to the message, if I come out of here, I can see my screen's changed now. It's very much cut down. The dosing tab's gone to be replaced with the Dabigatran tab, and all my information's kind of cleared out. So I'm now on Dabigatran. I can see that at the top left. Now what I might want to do is actually schedule a follow-up for the patient. So when are they going to come in again? I'm going to click on this icon here to add a follow-up, and I'm going to double-click on Dabigatran for follow-up here. I'm then going to give them a due date. So let's see, they've been moved on to Dabigatran today. I think I'm going to see them again in 6 months. I think that's sufficient for now, just to get them going. So let's see them back in September. Going to OK that, and I can see I have my follow-up listed here, and it's in a scheduled state for the 11th of September, so that's great. So as far as I'm concerned with this patient, I'm now completed. I can come out of there. So let's come out of that patient screen. Now, I might want to use a list views. I want to see who's scheduled for follow-up. So let's go into the list views section, and let's go into our non-VKA list view. I can see straight away from here I've got one patient that's actually overdue a follow-up, and I can see I've got 3 patients who are scheduled for one. So let's go back into Jason Stafford here, and let's just imagine that it's September. 6 months have gone by in flash. It's September. He's popped in for his follow-up. I'm going to go into his follow-up questionnaire and have a look, evaluate him. So I have his details at the top. I have all of his treatment plan information here, his indication, duration, and Dabigatran dose. I then come to the questions to ask Jason. So, taken the correct dose every day, yes or no? Might have taken too many capsules or tablets? Might have missed 1 or more doses? Is he taking lots of meds? And how's his stomach? Okay. Scrolling down, any problems with compliance? If so, these are just simple checkboxes to choose. Has the patient reported any adverse events? Again, just checkboxes to choose from here. And then we come to our creatinine clearance or Cockcroft-Gault estimate. So how has that changed? Has that actually changed any? Okay. Again, if I click on calculate, I have my estimate here. The patient still has mild renal impairment, so we're still good to go on Dabigatran for now. I have my hepatic impairment checkbox, my other blood checks box. And then we come to our contraindicated and interacting drugs. Obviously, when the patient started on Dabigatran, they maybe weren't taking anything else. Obviously, since they've started, maybe they now are on a contraindicated drug, which means they're no longer suitable for Dabigatran. So again, checkboxing one of these will turn bright red and let us know. Again, we've got just interacting drugs. Like with the initiation questionnaire, if I click on one of these, I will get guidance over on the right corresponding to that. Other anticoagulants. Any other details in there? Other contraindications. Anything else we found out since the initiation questionnaire that we need to know about? Any other hemorrhagic risks? Again, just check boxes. We then come to Chad's FASC and has bled again. So again, they might have changed over time. Okay. Scrolling down, we then have, okay, procedures planned. Do they now have any procedures planned at all? Do we know of anything upcoming? If not, we've just got general comments. Okay, anything else we want to log against this patient, pop in comments. As soon as I'm done with the follow-up, I can mark it as complete, and I can close out of there. I now have my initiation completed, I have a follow-up done. The only other thing I need to do now is, if I'm going to see the patient again, say in 12 months' time, all I need to do is click on the little icon here, add in another Dabigatran follow-up, and choose the correct due date for them. So let's bring them back next year. If I OK that, I have my date now again to see them again next March, and that says scheduled there. And you can see as well, there's a high visibility in this DORM system, because what we can do is, say a patient starts on warfarin, they move to Dabigatran, they then, for whatever reason, it isn't great for them, so they move back to warfarin. You can see all of those separate steps within the DORM product. So in this particular example, you can see that the patient was initially started on Dabigatran, and we can see the dose there, but this treatment plan has been stopped. You can see the reason. They had compliance problems. They've actually been stopped on Dabigatran and again restarted on warfarin, and you can see what they're taking there. So you can see the visibility between the two. You can see all of the treatment history for that patient. Okay. So in summary, we can see everything. It's all visible. We can see all of the anticoagulant history, both warfarin and Dabigatran. We can ensure that the patients are on the appropriate drug and the appropriate dose as well. We can schedule in follow-ups for the patients. So again, we don't lose track of them. We can see how they're doing. We can manage missed follow-ups, and we can use reports and all of the audit trails as we can in the existing warfarin system.